Welcome, everybody, to Hump Day Happy Hour, hosted by Dentists in the Know. This is the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We are pulling back the curtain on the industry. We're talking to the experts, the educators, the innovators, and the everyday clinicians who are out there doing the work. There's no fluff, there's no filter, and there's definitely no sales pitches disguised as education. If it's happening in dentistry, from the clinical insights to regulatory curveballs, or maybe it's the latest scandal at the ADA, we are probably already talking about it. And yes, we are bringing the goods. It doesn't matter if you're a seasoned doc or anyone in the dental industry for that matter. Maybe you're a curious consumer, or maybe you're just here for the banter. We welcome you all to the show because around here, we're not just in the loop. We are in the know. Hey, everyone. I am Dr. Jeff Horowitz. I am accompanied by my amazing friends and amazing clinicians and amazing educators, Dr. Chad Duplantis and Dr. Jennifer Bell. The three of us created this humble little platform to make the dental world just a little bit smaller, but a lot more fun. Today, we have a great topic. Pediatric dentist Dr. Jeanette MacLean is on with us today out of Arizona. Really excited to talk about maybe putting the drill up more than we used to think about putting the drill up. So love this topic. Love to talk about the people who save our hides by seeing some of the kids that we are not always so excited to see. So just really looking forward to talking to Jeanette. And just want to say thanks for being with us and hello to my friends. How are you doing?
Hi, friends.
Oh, how is
Chad looks so zen. JB looks very patriotic for Memorial Day, for those who can't see her. And Chad looks like he took 4 Valium or something. I don't know.
Did he have a pediatric dentist sedate him before he came on tonight?
It's been a very long
What's going
week.
on there, Chad? You look so mellow.
It's just been a very long week. I mean, it's just been exhausting. So it's good, but it's a long week.
We're only an hour past your bedtime.
Do what now?
Did you have a massage before you're chill?
Did you do the dirty?
Dude, I have not had a massage. I have not done the dirty. My back is killing me. My shoulders are killing me, but that's okay. It's all good. I'm here.
It's okay.
I was racing to get here. I am good. All good.
Okay.
How are
It's
you?
good to see you both.
You as well.
Hey, guys.
Yo.
10 days out from the early bird deadline being over. Should we talk about it?
Yeah, let's do it.
Let's do it.
So for those who don't know, we are hosting our first in-person dental education event. But this isn't going to be, tell them, guys, this isn't going to be your average.
No.
Let's get together and cram a bunch of CE hours in one weekend.
We are going to have some fun. We're going to have some incredible
music,
education.
Evening events, the education. I mean, guys, we got Doug Thompson coming in.
Yeah.
I geek out over his.
This is a functional extravaganza. We are starting with the body. That's where Doug Thompson is going to lead us off, talking about the oral systemic connection and giving us a great lead in to talk about how airway, TMJ, orthodontics, and bringing that all into context by talking about the restorative work that comes after you've made the assessment about all of the things I've just mentioned. So we really put some time into planning this, and we hope you will join us. It will be just a ton of fun, and it's going to be in my backyard in Murrells Inlet, which I'm excited about. So we've got some inside stuff planned.
Wait a second. It's in your backyard?
It's in my backyard, literally.
Literally in your backyard.
I didn't sign up for that.
Bring your trunks.
Are there tomato plants in the backyard?
What's that?
Are there tomato plants in the backyard?
There are. Peaches, tomatoes are back there.
Peaches
is no longer, but the tomatoes still linger.
Wait, hold up.
Hold on, Jeff, you got to tell the story. I'm sorry.
So, we have all these tomato plants back there because we used to feed Peaches, who was the 350-pound pot-bellied pig that used to live in my backyard and, unfortunately, for a little while in my home. And, yeah.
JB, you don't know this?
I know all about Peaches, but I don't know about these tomato plants. But I've already kind of done my.
We're gonna bring my son Luke Horowitz. Yeah, we're gonna bring my son Luke Horowitz on, who bequeathed Peaches to us. But anyway, we used to feed Peaches. Loved tomatoes, and Peaches would eat those tomatoes, and she would void said tomatoes.
Yeah.
All over the yard, and all of her little void areas would create a circle of life where we would get new tomatoes to feed Peaches. Many of those tomatoes still living today.
So the moral of the story is, don't eat a tomato sandwich from Jeff's house.
JB loves a tomato sandwich.
Yeah,
Jeff's like, oh, hey, do y'all want a BLT? Oh yeah, Peaches died last year and we're eating her shit.
Yeah,
sign me up.
Yeah, and she's the B.
Exactly. That's what I'm saying.
That's ironic.
She's the B and the T.
It's.
I don't know what to say.
Welcome to welcome to Conway, South Carolina, home of Vanna White and the Peaches BLT.
The Peaches BLT, Peaches Corner.
Oh, Peaches Corner.
Yeah, that's a real thing.
A few hours there.
Yeah.
Wow, we've gone 7 minutes and haven't mentioned the first word about teeth at all, have we? I like that, though.
Teeth.
All right, smile, guys. Now we've done it. There's teeth. There we go. So, JB, what's going on in news? Anything interesting?
Oh, Jeff.
I will tell you this, whether you mention it or not, I don't know if you had this, but going through the South Carolina House right now is a bill to eliminate any type of restrictive covenants or non-compete clauses in the medical industry.
Whoa, did not have that in my...
Yes.
Huge. There was something else out of South Carolina this week, too.
What's that?
There was something else out of South Carolina this week, too.
Yes, there was. Yeah.
All kidding aside, I think they found like 4 teeth in a resident there, which like set a world record.
Yeah. Was that the state? Is that the state fair? They actually walked around and saw 4 teeth total.
Yeah. No, actually, there was another news story out of South Carolina this week. Like a non-joke news story. I can't remember what it was, but it was there.
Yeah. Lots of stuff happens here. As the mantra goes in South Carolina, thank God for Mississippi.
Yes.
Actually, California has that problem now.
Yeah.
In education, they're not doing well, and actually at 49 or 50.
Wow. You know what we do lead the nation in South Carolina? STDs.
Homegrown tomatoes?
And do you really?
We do. We are at the top of the list of STD.
Huh.
Yeah. Afflicted.
Dirty Myrtle.
Yeah. I don't know. It could be Coastal Carolina.
That's an unknown fact. I don't think any people knew. But are probably really glad now that their state wasn't included.
Well, I think half of them are at the nursing homes here that are popping up all over the place.
Was the Villages, but
dude, the Villages. Yeah, I actually said that in the golf shop. The guy was like, "Oh, this is gonna be the last time I see you. We're moving to the Villages." I was like, "Well, you better glove up. Be careful, fella. I heard it's rough down there." "Oh, that's a fake story." I said, "Bullshit. I tell you what, I have read the research. You're in for a wild ride.
Enjoy.
Yeah.
Needless to say.
All right, guys, let's get some news out there. I think we need to buckle down a little bit, but I I love the hang. So,
Same. You ready?
okay. All right, do it.
Okay, guys, we've got a couple news stories for you tonight. It seems like maybe a few might be a little controversial. Let's go ahead and talk about what Jeff brought up, which I'm so glad he mentioned it because I actually was not on my radar, but it's definitely worth mentioning. It is House Bill 4767 in South Carolina, which is looking to remove non-compete clauses for the medical profession. I love this. And I love, you'll remember there was a federal move for that to happen and it ended up being overturned. So I love that states are now looking at it independently to say, look, one easy way to solve a workforce issue is to eliminate this competitive structure that exists in our contracts for medical providers. If they want to leave a group practice and go start their own, if they want to move to a geography outside of a practice where they sold or whatever it is that they want to do, that they should have freedom to do that. And there should be plenty of work for all of us because after all, last I heard, most areas suffer a workforce challenge and need more qualified dentists to do dentistry. This probably would also apply to any other employee in a medical practice that's under contract. So in the dental space, it could be a hygienist, I guess, if they're signing contracts, but certainly in the medical space, you probably are looking at nurses, PAs, nurse practitioners, et cetera. So this is very interesting. Definitely going to watch it because I would love to see South Carolina be the first and take charge of this because typically, as we've seen with many other bills in the past, once a state successfully enacts it into law and puts a non-compete clause like this into effect, many other states will take up that banner to see if they can get it to pass in their own states. We saw that with medical loss ratio. It took Massachusetts to carry it across the line. And once they did, we saw 10 other states pick it up pretty fast. So maybe this is now a state's issue and not a federal issue. Good luck, South Carolina. Another news article out for you. I would love to rally the troops around this particular one. This has been a passion project that we've talked about for several years now. And that is about this loophole of non-covered services. And guys, we've talked about this a couple of times. I'm going to remind you all again for the third or fourth time that many states, in fact, I think it may be over 40 now, have enacted variations of laws that protect dentists when certain things are not covered by a insurance plan. So let's say a patient comes to you for veneers, which is usually a cosmetic procedure. If the federal law applies, you're obligated to take the write-off on that procedure, even though it would not be a covered service by the insurance provider. Most states have put into place a protection clause that says that you can, in fact, bill with state-funded plans or non-self-funded plans, non-federal government plans. So that doesn't mean everybody gets billed. It means if they fall within that bucket, they get billed. Well, you know what a nightmare that is to figure out. And in fact, most insurance companies won't disclose to you on the phone whether that plan follows state law or federal law. If it follows federal law, you have to honor the write-off. If it follows state law, you don't. Well, there's been some movement and there's an Improving Dental Administration Act, HR 7931. This is a federal act trying to make this a simplified process and that we will be able to apply a standard rule across all states regardless of the plan. I, for one, am a huge fan of this. And actually, honestly, no matter how it shakes out, simply because it would just be nice to know, to be able to disclose that to patients and then decide if I want to do procedures that are covered or not covered, especially if they're elective procedures. Currently, there are more than 360 dental insurance reform laws over the last decade that have been passed in variations. Many of them hover around virtual credit card payment, network leasing, and downcoding, as well as these non-covered services. There is a huge grassroots effort to try to get this thing across the finish line. If you're a member of the ADA, if you go to ada.org, you'll find additional information there on how you can contact your congressman to get them to stand for the Improving Dental Administration Act, HR 7931. If you are not a member of the ADA, you can still do that. Just you'll need to go directly to your congressmen or women and communicate to them that you would love this to be standardized to make it easier for all of us to ultimately be able to provide good qualified information to our patients. This legislation would involve prompt payment, non-covered services, virtual credit cards, network leasing, assignment of benefit, and prior authorization continuity to self-funded in addition to fully insured plans. So there would be now a standard rule that would ultimately default to how the states have been trying to operate for years. So remember, Improving Dental Administration Act, HR 7931, grassroots effort, reach out to your congressmen or women. The last thing I'm going to close with is the controversial one, I think, simply because we here at Dentists in the Know are a big fan of functional dentistry, as evidenced by our desire to host our first functional symposium in November in Murrells Inlet to talk about all things systemic, airway, TMD, rehabilitation, and support of those patients. The AAO is doubling down on the fact that they may or may not believe certain aspects of what general dentists seem to be supporting pretty strongly. I got to be honest, I was a little disappointed to see the paper come out. And I've listened to a couple folks and a phenomenal podcast, which I'm really hoping we can get that individual on. I would love to dive deeper into his analysis. He's got the receipts and he's done the homework. You know, for many of us, it's the gut feel. It's what we see as GPs as we practice on patients for the duration of their life here on earth. We see the good, bad, and the ugly of how it all comes out in the wash and how these patients get healthy and sick throughout their lifetime. It would be really helpful if we as a dental profession could get on the same page and be collectively providing a similar message to our patients. And I'll leave it at that, but I would love to get some of our friends on who are pretty passionate about GPs and orthodontists working together to support healthy airways, healthy mandibles, healthy maxillas, and healthy palates for the benefit long-term of the patient. Hate me if you will, but I'm only interested in what is best for the patient. And with that, that's the news. You know, we're heading into Memorial Day weekend and people are like not wanting to stir the pot too much before they go on vacay. So
I hear you.
Not me though. I talk about the AAO, so clearly I'm not concerned.
Yeah, that's fine though, and I am working on a couple of special guests to kind of cover some of that. I really
want to have a deep dive on this one.
Yeah, I agree.
I'm all for it. I think that's a great idea.
Well, we have an amazing guest who's going to introduce her because we made her wait.
I'm happy to.
Will you do that?
I would love for you to. That'd be great.
Right. I'm very excited.
Very excited. Yes.
Are you ready?
Yes.
All right, guys,
Let's do it.
Please join us. So we made a friend in Cabo. We made a couple friends actually because Ada and Don Metcalf always bring amazing speakers to their annual Aspire meeting, hoping to see everybody again there next year in 2027. And lucky for us, some of the new speakers that we had at Aspire this year, we had never met. And so it was a great opportunity to start to get to know people and bring on new guests for our podcasting friends. So Dr. Jeanette MacLean practices in Phoenix, Arizona, and she's coming on tonight to talk to us about non-invasive pediatric dentistry and maybe some of the updated techniques in pediatric dentistry, because frankly, some of us practice more pediatrics than others, but I think we could all use a little crash course in pediatric dentistry. Where are we today? What are we doing that we were taught in dental school? What do we not do anymore that we were taught in dental school? Because there's got to be some variation. We've definitely seen it in the GP world. All right, without further ado, let's talk. You have the credentials. We're going to post it in the comments so that everybody can make sure that you know exactly what you're talking about. You had me when you dressed in the 90s decade. You just had me. You had me right there in Cabo. So Cabo, we had a decades party, and I just thought the 90s was such a creative decade, and I really missed an opportunity there for some stuff that's still sitting in my wardrobe. Then your family was there, and it was a beautiful thing. So, yeah. Jeanette, thank you so much for being with us tonight. Let's talk about kids.
Woo! Thank you so much for having me. Yes, our family went full grunge.
It was awesome.
And it was fantastic. And my children willingly participated in the dancing, which that was shocking. Two teenagers
were all in on the dance floor.
They were. I was very proud.
It was a beautiful family moment. I mean, how many times are you going to get to dress up in a decade together with your kids?
Not many.
Not many. So
You have
I'm
two
glad
kids?
you had that time with them.
I
Too.
have
It's really
two.
awesome.
Okay.
I have a 14 and 16-year-old.
That's fun stuff. Good time.
Good times.
Yeah, and
Are
it's
you entirely
amazing
stupid
working
in your eyes?
exclusively on kids that you wanted to have kids.
Yeah.
They did not scare me away. However, it did teach me some tips on parenting styles that do and do not work.
Yeah, that's for sure.
Want to give us a top 2, 3?
Like
I could say
no,
some
you're gonna get a
things that will
reward.
offend I could say some offensive things,
Yeah.
and I will not.
Okay, we'll do that at the after dark.
But just like, letting your kids have some space and be independent and self-sufficient.
Yep.
And not always get their way, and it's not all about making them happy. Just getting them to build resilience, coping skills. It's a dying art, sadly.
So not promising a reward for just very average behavior.
Rewarding horrible behavior. That's my favorite.
Yeah.
Like the kids who act like a fool and they're like, "Oh, we're gonna take you to Target. I'm so sorry. That was so scary." It's like, we brushed your teeth.
Yeah.
You're okay. It was not brain surgery.
I'm sure in your realm of dentistry, you've seen it all.
Oh, I had 2 decades in. I've seen some things.
So let me ask you this, because I think before we get to, kind of the meat of the conversation, I think there's a question that comes up a lot, especially in young dentists. The first part of the question is, do you allow parents in the room with their kids?
That's a good one.
Mm-hmm. What a beautiful question. So when I first started, or when I trained, it is completely different to how I practice now in many ways, which we will discuss.
That's what we're going to discuss.
Mm-hmm. But one of them was that, like, the parent was kept out. They were the enemy. Like, keep them out. The kid will be better if they're not there. I think once I became a parent myself, that's when things really changed. Because, I don't go to the pediatrician when my kids were, 2 and 3 and 4 and say, "Bye, go have fun at your well visit." Like, I went with them, and that was my opportunity to ask questions or to learn things, right? So that was one aspect of it. But also, we've become such a litigious society. I would rather have the parent there seeing what happens, for a multitude of reasons. One being, I can't be falsely accused of things that did not happen. I have had that occur. Case in point, like, I've had kids who did amazing for operative, just like little rock stars, and then we take them out and reunite them with a parent, and all of a sudden they're the Oscar-winning actor, like, it was horrible. And you're just like, you were literally fine. It is so infuriating. I'm like, you little manipulator. And, the parent, that's the one that's going to go to Target. So none of that anymore. And then I had we will see kids even through college if they don't have what we consider adult needs. So as the teenagers start driving themselves, right? I remember we had a teenage girl who drove herself. Everything was fine. Later we get this angry call from the parents saying that the girl claimed that we were talking about her makeup, talking about her clothes, or like her shorts being too short. Like, none of that happened, right? And then her chart got flagged that she can never bring herself alone. Like, the parent has to be there. But it's very frustrating when you lose that sense of power, that people could just make false accusations about you. So that's one element of it. But then the other element is, like, that's our opportunity to shine and show the parents, like, what we're good at, our skill in behavior management, but also to show them what's going on in the children's mouths. I hear a dog.
Mm-hmm.
Hello.
It's
not me. I have a cat. But anywho, I can show them the plaque, show them the crowding, show them the dry lips because they're mouth breathing, show them the worn down teeth because they're grinding. Maybe I want them to have a sleep study. This is the show and tell. Just thinking from anticipatory guidance, education from that standpoint, right? Now let's take it into operative. That's especially where we would like to perhaps not have the parent present, but sometimes having them there, especially if the child doesn't do well, they can understand that, like, we really tried our best, and this is why we are recommending sedation. Like, they can see, or let's say you're doing treatment and things change, like perhaps that cavity is too large and I have to do a crown. Maybe there's a pulp exposure, maybe the tooth is abscessed and I need to do an extraction instead. It's saving the back and forth and the telephone game. Like,
Right.
it's just a lot more efficient. Now, granted, we have families that come to us literally from the time the kids are toddlers until they're in college, and that builds that really nice trusting relationship. And we absolutely have parents who know that their child, or they recognize that their child will do better without them there. Although I must say that's becoming less common. And there are more parents who are unaware that their kid will act worse if they're there. But yeah, they are welcomed and encouraged, especially for recare, hygiene appointments, stuff like that. I do welcome them for operative, but we set ground rules, right? Like, it's my house, my rules. We want them to be a silent observer. Don't use trigger words. We have a list of things that we don't want them saying, like shot. That's a 4-letter word. Drill. The things that instill fear, because what we do is so different. So I get that some of these parents perhaps had a bad experience themselves as a child, which is unfortunate, but that is very different from what we do now in a modern dental office. There's so many things that make it an easier, painless, quicker, faster, simpler experience that most of these kids actually, especially once they get to know us, they look forward to or actually enjoy their visits. And that's really rewarding, because then when the parents say, like, I used to hate going to the dentist and my kids are asking when's their next appointment, like, that is such a win. And that's the goal, right? To have them actually want to come see us versus dreading it or being afraid of us.
It's so interesting to think about, parents now that have had bad experiences, because, like in my office now, I mean, most of the parents are kids that I treated. And so I know the experiences they had, and they were good experiences. And I think most of this generation, for the most part, this generation of parents have had mostly positive dental experiences. Maybe there's a few that didn't, but yet I still find the parents even
I must have bad luck.
Yeah. Well, I find the parents even more protective now than they were then, when there actually was a generation of parents, especially around here, that did have really bad experiences.
Sure.
So it's an interesting perspective.
Yeah. Well, I mean, you're obviously a good and caring, wonderful practitioner, and these are we call them grand patients. Like, if you treated their parents, like, they've had that nice experience. But I do encounter parents that are, younger than me, who did have a terrible experience, and my heart goes out to them. It still happens. And we don't want that. We don't want them to share that with their children, because sometimes they poison the child against us. Sometimes they use us as a threat. That's really frustrating. They're like, she's gonna pull your tooth out. And it's like, you are not helping. Right? I hate to say it, but the dads tend to do that a little bit more, and they think it's funny.
They think it's
and
hilarious.
then I just try to turn it around. I'm like, no, you're gonna get a shot, or we're gonna pull your tooth out. We always try to flip the script, if you will.
I have to tell you, sometimes though, our own ideas of what we think will make a kid like us or be cool also backfire. So just a quick anecdote. I had a kid one time, and I was using a laser so I wouldn't have to anesthetize them. And we think that's great, right? So we can cut the little cavity out, clean everything up, and then we usually don't have to numb them. So I said, oh, it's just a laser, like a lightsaber. I'm going to use a lightsaber, and we're going to wipe this cavity away. He goes, you're going to cut me with a lightsaber? And I was like, well, that backfired, really fast.
oops, that escalated quickly.
No, it's not actually a sword.
I thought it was cool. I got the analogy.
Cool, and it blew up literally in my face, and I was like, well, that really didn't execute quite like
I thought you were gonna say he didn't know what a lightsaber was.
No.
I'm like,
he knew too well.
Don't make us feel
Star
old.
Wars legacy has gone on long.
Yes. The Force is strong in my daughter. We're quite proud of her being an avid Star Wars fan.
I thought I was gonna get a lot of street cred, but instead he clammed up, and I was like, it's
wow.
Actually,
call him a Jedi next time, and I'm telling you, you'll win him over every time. But I do want to say that you had me at your first few words, because you said when I became a parent, and I think that a lot of things change. I really don't like listening to people who are like, absolutely not. The parents cannot come back in. They're told in the waiting room that that's not allowed in our office. I love how receptive you are, and I feel the exact same way. It's tough sometimes, but I think that we do have to give the parents that opportunity, because after all, those kids are minors. They are our responsibility when they're there, but beyond that, they're truly their parents' responsibility. And if the parents you want to be there, I want to give the parents the opportunity to be there. So kudos to you. I think that's a wonderful outlook on having parents back.
Thank you for saying that. And I think we just need to change our perspective on it. For sure, when I was younger, it was an insecurity thing.
Yep.
I was insecure. I was intimidated by the parents. And in a way, it was easier for me to not have them there. But we just have to think of it differently. Like I said, think of it as your opportunity to shine and to educate, and also to protect yourself.
Well, we have
it's
to
not
adapt.
a bad thing.
We have to adapt. I mean, we have to take what we learned in dental school and residency and whatnot, and be able to add our own modifications to it. Because if we can't, then we're not doing the right
to
thing.
Jeff's point, you mentioned, it's changed. I think part of what has changed, and maybe why people are more overprotective now, is you think of our culture in terms of social media and the media in general, things that maybe we would not have seen or heard of now are disseminated very easily and rapidly. So when, for example, there's scandals, right? Like deaths from sedation, molestation, like we had recently in our state, an assistant that was doing inappropriate things to child patients while taking their x-rays. We have to remember
I ever have that assistant when I was a kid.
I don't think you want, but the thing, I will have to remind my staff, because my staff sometimes gets nervous about why is the parent following me to the x-ray room? I'm like, listen, put yourself in their shoes. If they just saw on the news last night that some creep was taking pictures of people's little girls and stuff, you bet you would want to be they don't know you. We build their trust, and then they, it changes. But especially a new patient or someone who's not familiar with you, if they're seeing that in the news, they're going to be nervous. I get it. And we shouldn't take it personally, because it's not against us. It's just them trying to.
Societal changes. I mean, when we were kids, I would go out on my bicycle till well after dark, and it was fine. Nowadays, I would not let my kids go to the end of the driveway on their bicycle.
Now you'll get reported to CPS if you let them go out by themselves.
Yeah. So I
child neglect. I guess I was neglected too.
As a parent in today's society, I get it.
Yeah. Jeanette, how do you know what technique is going to work with a particular child? So the point that you made was so well taken, that you can't just have this one universal set of rules and say, this is what I'm going to do for every child. Because I was taught also, never have the parent back in the room with the child. You have to be the person in charge. And of course, I adapted over time. But how do you decide what's going to work? Like Jennifer using the lightsaber. We mentioned before the show that I just put an RPE in for the second time on a 3-year-old. And, one of the things I did with him is he loved monster trucks. And I was like, oh my gosh, look at this. This is a monster truck part. And you're going to be like a monster truck, and thinking this is going to be the greatest thing in the world. And he's like, I don't want a monster truck in my mouth.
I like to say I use my spidey senses.
Yeah.
And I know that might sound corny, but it's the truth, like I really read the room. I'm looking at facial expressions, body language. I'm looking at the parent. I will tell you, the closer the parent hovers,
Yeah.
the worse that kid's going to be, because they're going to they feel the anxiety from the parent, and they're like, oh, danger approaches. Like that's someone where you really, take your time. I absolutely believe in tell, show, do. We really spend time to use models and photos and let the kids see and feel and touch what we're going to do, right? Like within reason. I mean, there is also some smoke and mirrors, but let's say we're going to do sealants. I've had kids react like your lightsaber reaction when I said, "Oh, we're gonna put sealants," and they're like, "You're gonna what?" And I'm like, "Whoa! Let's calm it down. Let's calm it down." And then I go and I get my little ADA brochure and I'm like, "Look. See, we're going to put this little coating over the grooves. It's like frosting a cookie. Do you ever decorate cookies for Christmas? Have you ever made a gingerbread house? Your tooth is going to be like the cookie, and the sealant, it's like frosting, just kind of talking them out off the ledge. I'll hand them a mirror so they can watch that. There's something magical about giving the kid the mirror so they can see what we're doing. I don't have them watch me give local anesthetic or do extractions, but I will have them watch me do a filling. And it's amazing because we have TVs on and they can watch Bluey, but sometimes you hand them a mirror and you're doing a class 2 and they're like entranced, like,
Yep.
and then the parent is just eating it up. They're like, oh my, this is so fun. Like they're having the best time. And they'll say, I wish I had a dentist like you when I was a kid.
Yeah, you're like,
I don't know
Bluey
if I'm
didn't
answering your
exist. I
question
hate
or just
that little blue bastard.
going off on a tangent, but every
love
child is unique. You can't use the same things or jokes for everyone. You just and sometimes it doesn't land or it doesn't stick, but
What did
try
becoming
again.
a parent yourself, did that help you maybe kind of understand children's behavior from a different perspective,
Sure.
and that parent-child dynamic?
Absolutely. And to your point, also just beginning to observe different parenting styles and knowing how to use that to my advantage to approach them a little differently. And I mean, I guess it's TMI to say, but it certainly comes with experience just as a clinician, because there's wonderful pediatric dentists who don't have kids, but it also is advantageous to have kids of my own. And I'm realizing now we haven't even talked about any of the new things that we have now in pediatric dentistry that eliminate the scary things like the shot, the 4-letter word, or the drill. So that's been the biggest change in the past decade. That I was an early adopter of silver diamine fluoride, and that's kind of what. But I like to say I'm the accidental speaker because I never sought out lecturing. I was asked to give my first lecture on SDF to the Midwestern faculty, like their school is just around the corner from my practice, and I had a full-blown panic attack trying to get up there, and I was like, I've gotten better with experience, but that was sort of, you could say it was my but yeah, silver diamine fluoride, that just sharing those cases online, really being an advocate for awareness and adoption of that as a technique, that kind of snowballed into I guess you could say it was my gateway drug into other minimal interventions like Hall technique and atraumatic restorative treatment using more glass ionomer, et cetera, et cetera. So that's really changed dramatically how I like the way I practice now is so different from how I was trained in residency. It's like night and day, and it's very rewarding to see that our specialty as a whole has evolved and adapted, because I still do sedation, I still do like conventional surgical pediatric dentistry, but there's so much more I can do, and or that I can delegate to my assistants and my hygienists, which helps, increase access to care and reduce costs and reduce risk, all these wonderful things. It's really a great time to be a pediatric dentist in terms of what we can do. I mean, in some ways, it's not a great time because, parents and kids are becoming a little bit more difficult to manage, but it's certainly easier to manage them when you can do things without having to sedate or numb or drill teeth.
Do you have a papoose board?
I do. And that's controversial. So let's talk about that.
Let's unpack that
Let's
a little
talk,
bit.
Yeah.
let's talk about that. Sometimes I just want to papoose the parents.
Yeah.
Is it possible?
Team members.
That's why we have it.
Face down.
You need a timeout. Timeout. You're going to go.
Yeah.
So
You're going
we have
face
them
down on the papoose.
Yeah.
So some people, like I have a good friend who had a thing where they burned their papoose boards. Like, I get it. Like, the thing is, there are certain situations where I use them. So in some instances, we will have an emergency situation where we literally cannot sedate, and the proper term is protective stabilization. They're safer in that than us physically trying to restrain them, because you
Correct.
could break an arm or whatnot. So let's say you have a trauma on a 1-year-old and I can't sedate them, or maybe they already ate and I have to do an emergency extraction. Sometimes, just like if you went to the emergency room, guess what they do there sometimes too? They have to, swaddle you up and get something done. So emergencies, sometimes with our combative special needs patients, I'm sorry, these families don't want to have to do GA and go to the hospital every 6 months just to have the teeth checked and do a prophy, right? In some cases, it's just as simple as like the weighted blanket. We don't use aprons anymore. Guess what? A lead apron is really good for
Yeah.
a weighted
Same.
blanket. Even that,
Yeah.
sometimes just the pressure of that on our patients that are on the spectrum, it helps regulate them, and they like that sensation. And then the other example is we will use them when we're doing sedation. We call it like the sleeping bag, or it's the car seat of the oral sedation appointment, because I don't want them rolling on the floor or lifting their hand up and having me accidentally, put a needle in their eye and blind them. It's for safety. We never use it as punishment. I think the problem is, and why they've become so controversial, is that there are offices that still to this day will just use nitrous on screaming, crying, hysterical children and their papoose, and they're just going to town doing 4 quads of restorative dentistry. That's barbaric. That absolutely should not. And that there's so many legal issues with that too. If and when you need to use a papoose board, because there is sometimes a time and a place, you need to document why. And like when they go in, when they come out, that's important just for your own CYA.
I'm referring my papoose needed patients to Phoenix.
Yeah.
And I
Okay.
guarantee you could probably get through it without the papoose.
Remember,
Good
Chad,
luck.
she doesn't treat adults.
Yeah.
Oh, I do treat adults with special needs.
Okay, fair. But
Oh,
I think
so you
he's
could
just
treat
thinking of
Chad.
difficult patients.
Thanks,
They
Jeff.
just need a little huggy hug, little extra love.
Yes.
Chad
Okay.
loves Mr. Thirsty.
I have a quick. I think so. Something I've been struggling with as a practitioner, and I would love your feedback.
Mm-hmm.
We've got all these new invasive procedures, so let's put SDF, Curodont. We could talk about the SMART technique and maybe just define that for our listeners that aren't familiar with it, because
Sure.
I may not. I'm doing a regular exam and I see incipient lesions, maybe buccal lesions. How am I, as a GP practitioner, discerning? Is this a Curodont that I want to do? Is it an SDF? Walk me through some of your thought processes when you're doing a treatment plan and you see a kid for the first time. Where are areas you're typically going to go more towards the Curodont type of protocol? Maybe where areas where you might go SDF and try to do some glass ionomer. Kind of walk me through that thought process.
Sure. Well, I would say that I do SDF the most.
Okay.
And that has a lot to do with the fact that it does have the best insurance coverage currently. And especially if it's primary teeth in the posterior, a lot of parents will prefer to go the route of SDF. I would say I use Curodont more in the anterior.
Okay.
Or where it will be more visible, and they don't want the stain from the SDF, or in permanent teeth, for example. But that being said, I'll even have some patients where they are fine with SDF on their permanent teeth, especially proximal lesions that aren't really visible in the posterior. I have SDF in my own mouth. Can you tell?
No.
So you don't necessarily see it. Like, one difference though, like, you can use SDF for hypersensitivity and exposed root surfaces and even cavitated lesions. However, Curodont, that's going to be non-cavitated, so incipient E1, E2 lesions. But they're both viable options. And then also the Icon resin infiltration. I mean, that would be in there too if you're talking a non-cavitated, even up to a D1. So in the outer third of dentin, but non-cavitated, you can do Icon resin infiltration as well. I do that mostly in the anterior for aesthetic reasons. So let's say it's post-ortho white spot lesions, or what I like to call ring around the bracket. Is that landing with, like, remember ring around the collar? Yeah. Who remembers those commercials? Okay. Whew. But yeah, ring around the bracket. And then a lot of kids who have congenital enamel defects, molar incisor hypomineralization, because Curodont, I fear, or what I have noticed, is that there are a lot of misunderstandings of what certain treatments can and cannot do. And Curodont really is a caries treatment. So an incipient caries treatment, it's not a cosmetic treatment. It's cosmetic in that it does not stain, but if you have a discoloration, it's not going to magically make that disappear just because the hydroxyapatite crystals that it forms are needle shaped. So you could still see a white spot. It might be shinier and harder because it's arrested, but you might still be able to visualize that. Whereas with Icon, you have more of a predictable, and within that same appointment, you're going to know if that spot's going to be no longer visible and arrested. But yeah, I do. So I do a little bit of everything.
In interproximal, SDF works best if it can touch the lesion, correct? Like it needs to have direct contact. My understanding.
Well, but it can get interproximally. I just saturate the contact area. Okay. So there's certain areas of the mouth where it will be more or less effective. So the more open the lesion is, the more likely SDF alone can arrest a caries lesion. Okay. Even a cavitated caries lesion. So smooth surfaces, buccal, lingual incisors, those are going to be predictably successful with SDF. Occlusal surfaces, so they're fissured, moderate risk of progression. So maybe let's say treating the child as like trying to bathe a cat. I might get 1 minute to paint some SDF on there, right? But you have to etch to put Curodont. I don't want acid etch getting on a screaming, moving, little kid. So that would be a reason to do SDF over Curodont in that instance. But I could put SDF initially to help arrest and remineralize the caries. Like, think of it like buying time or stabilizing it. And then perhaps as they build trust and rapport with me, maybe the next time I encounter them and they realize, okay, well, she's not so scary and that didn't hurt and she gave me a gold coin. Maybe I'll give her 3 minutes of my time. Maybe at that next encounter, and if it's an occlusal surface, which is more likely to progress, I could put glass ionomer sealant or glass ionomer restorative material over the top versus reapplying the SDF. So that's what you would call SMART technique. So silver modified atraumatic restorative treatment, meaning SDF as the initial treatment to arrest and remineralize a caries lesion, and then a glass ionomer material to continue remineralizing, but also to restore like a cavitated lesion, or for prevention, let's say it's a fissured groove, right? The most likely to progress with SDF alone would be proximal lesions, just because they're not open to remineralization as easily through saliva. They're not as cleansable, but I still do tons of proximal SDF. I see better success if it's confined to the enamel. Like once they reach the dentin, it may in fact just be a little bit of a time buyer. Like let's say we're trying to get that child to where either the tooth exfoliates, or maybe they're older, more cooperative, and I don't have to sedate them to do a filling, let's say. Once it's spreading in dentin, I'm recommending some sort of restoration, speaking from the perspective of a proximal lesion. Now, if I have direct access, I can just do ART or SMART. Sure. Just squirt some glass ionomer in there. Thank you. Have a nice day. Very easy peasy.
How do you address flavor problems? Because it's amazing. You kind of alluded to this, and sometimes you'll have a kid that is just so well behaved, goes through all of the difficult part of the procedure. You've explained your way through everything, and the kid's doing great. And then all of a sudden they get a flavor they don't like and lose it. I mean, I've had that happen numerous times.
And guess when it happens the most is with SDF.
Yeah.
Because SDF, have you tasted it?
Not personally,
taste
no.
good.
I challenge you
Yeah. Okay.
tomorrow. But there are ways to help, like specifically like with flavor version of SDF. If you do really good isolation and thoroughly dry the teeth before applying it, and then you cover it with a fluoride varnish when you're done, they're going to be less likely to have a negative experience of not liking the flavor. And then one other trick I'll do is the cotton roll that I've used to, like, let's say it's a lower tooth, that cotton roll that I've used to help isolate, I then have them bite on the cotton roll, and that will help soak up some of the excess. It's also a nice distraction because by that point they're sat up in the chair and I'm handing them their gold token and we're like, let's go to the treasure tower. So that's distraction. There's something, magical about that. Distraction is a classic behavior management technique to just get their mind off it. Now, fluoride varnish would be the next. I don't think there's a universally loved fluoride varnish. Even they're getting better and better and thinner and clear and all these fun flavors, but you're still gonna encounter a child who loses their mind because you've dared to apply.
Put mint in there.
Like, how it burns. Like, oh, please. And then they eat like Takis and flaming hot Cheetos. Don't tell me it burns.
I mean, this show isn't sponsored, and so I'm certainly open to suggestions, as are many of our listeners. What's your favorite brand of SDF, or is there one that you're partial to over others?
Sure. So I've been using since 2015, I've been using Advantage Arrest, and that's you buy directly from Elevate Oral Care. So that's the original that came to the US. Of course, it's been around since, 1970 was when it was first available in Japan as a product called Saffuride. But the product Advantage Arrest, that's the one that has like the NIH funded, like US based clinical trials that have the proven safety and efficacy. So, I mean, that's in my mind the gold standard. Now, there are other products that have come on the market. As long as the chemistry is the same, you should be fine. But I will caution you because there have been some products that have come to market that aren't effective and weren't the same chemistry. So you need to be cautious of that. Like water-based products or products where they're adding a second step. I mean, I don't want to get you in trouble and name names, but like there's one in particular where you add potassium iodide after. The problem is it binds the silver and then you rinse it away, which, like, logic, is that going to be effective? No, it's not. And guess what? It still will stay in an open lesion over time. So that was really frustrating when that product came to market 2 years after Advantage Arrest. Just like they saw the interest and like, oh, great, well, let's try to sell our product in the States, because it kind of flopped in Australia, where it was for many years before. I know too much about this. I could tell you more
That's okay.
details.
We're geeking out. We're good. You're good.
But anywho, yeah, that was
what about
some of
the
frustrating.
Newer nano-hydroxyapatite products that are out there for remineralization? Do you have thoughts on those yet?
You know who you would be an amazing guest? Do you guys know Dr. Ryan Nolan, who has he knows too much on that topic, but the problem is there's so many. I feel like every Instagram influencer in the dental field now has their own new nano-hydroxyapatite toothpaste. And like a lot of them are just crapola, where everything like congeals together and they don't really remineralize the teeth. And I will tell you that the trend of hydroxyapatite toothpaste has been fantastic for business. Mm-hmm. I say sarcastically, I am drowning in cavities. Help me. Help. Yeah. It's bad. And it's unfortunate. I am definitely seeing like a shift where now parents are realizing like, oh, and I'm seeing people coming back to fluoride toothpaste. You can still get cavities. It's just you're going to be more susceptible to them if you're not using a therapeutic dose of fluoride toothpaste. So yeah, I'm not really a big fan of.
I really appreciate your openness and honesty, because your thoughts are very similar to mine as far as to what I'm seeing on the marketplace. I was laughing inside when you started throwing out influencers, because I'm seeing people come out with
The dentist.
it's not necessarily the product that they're coming out with, but the marketing and the labeling behind it is just fantastic. And we don't know what's going to happen. We just know what's in it.
Mm-hmm.
So I appreciate
All right,
your.
I'm going to go non-clinical for a minute because you mentioned the treasure tower. And I want to talk about that.
Yes.
Because I too have a treasure tower. And so when I learn that someone else has a treasure tower, I feel a kindred spirit. And let me preface this by saying the motivating factor for me for the treasure tower was I was a dental assistant intern thing in college before.
Samesies.
Yeah, this might be why we both have treasure towers, because one of my jobs was to restock and clean the treasure chest. And the treasure chest would have a myriad of toys in it that no one wanted.
Step right up and win
then I would
some
order
crap.
from Oriental Trading Company what I thought would be appealing. What?
Jeff and I were going through the jerk.
Oh, you were doing
Go ahead, carry on.
You were doing the jerk. Anyway, so, but then always at the bottom of the treasure chest was a ton of toys nobody loved, like just the land of misfit toys.
The rejects.
And little tiny dead bugs.
Piece of hair.
Hair and gum sometimes. You just would find stuff.
Yeah.
So one of my criteria when I opened up my own office was that we would in fact never have a treasure chest that would collect said unwanted and unloved toys, gum, bugs,
residue,
whatever. I think it's important to tell our audience who's listening tonight, who's never heard of the beautiful treasure tower. Tell us about
It's
your
like
treasure tower.
Think gumball machine, but instead of gumballs, it's filled with like little plastic eggs and tchotchkes, and it's hygienic, right? Because they're in there. Tchotchkes.
Oh, tchotchkes.
Knickknacks.
I know that word.
I was gonna say, I feel like you should know that
you're
word.
You're getting kids to behave
Things
with
like
cheese.
this. Doodads. Thingamajigs. Junk. Yeah. Treasure. But it's hygienic because they can't go digging through it.
Correct.
Right? And the other reason I really like it is because in pediatrics, what happens is a phenomenon known as the clown car. And what the clown car is a child will come for their filling appointment, let's say, and the clown car comes through the front door. Mom, brother, sister, that looks like our original treasure tower. Their cousin, their neighbor that they're babysitting, like literally a clown car of people. We're like, how many people did you bring? And then the kid does great for their appointment. We reward them at the end with a token. And then inevitably, what does the parent say? Can they have a token too?
Of course.
Yeah. It's like, no, it's for the child that had the appointment, but it does take quarters. So if they want to reward everyone that tagged along and did nothing, if they want to reward them for breathing the air in the space, they can do that. We do let everyone have a sticker. We do get the cute little that. Okay, so they get something, but only the kid who we saw who did the appointment, because you're like, someone has to someone has to still teach kids to reward them for actually doing something. There's a lot of rewards for doing nothing.
Do the pro fee, they get one. If we're able to get x-rays, they get a second token.
We have been known to bribe for that.
Like very sweet kids that come in that they're like, can I get one for my brother who's in another room or whatever? And or with mom. And when the sibling asks for one for their kid, you're like, I mean, we're going to reward altruistic behavior,
I like when an older sibling gives it to their younger sibling. That's very sweet.
That's always very sweet. If you've never learned the treasure tower and you treat kids in your office, and here's the double thing that you didn't even mention. They get a token, which they're equally as excited about, which has no value.
Yeah,
and
they're like,
they go spend it for something else. Now it does backfire every now and then when they choose a toy that has colors or styles.
That's the negative. Yeah,
it is
another important life lesson: you get what you get, and you
Yeah, and
don't
you
throw
don't
a
pitch a
fit. So we
fit.
have
Yeah.
certainly had nuclear meltdowns when, like, I didn't want the purple one. A little boy yesterday. So
I
we
could do that
have,
in my
like, when
practice now, except put like Fixodent and Biotine in there and stuff.
So
people would love
You
it
could do
for
a senior
sure.
citizen one for your practice, Jeff.
Can
we
you
we
put like
have
the
this
little mini
huge
bar bottles of booze in there?
Thank
Yeah.
you.
we
There
have
you
this
go.
huge gumball machine that has bouncy balls in it, and they get a token, which of course has no value other than the bouncy ball machine. And the best is when they're excited to get it. The worst is when two siblings get it, because it turns into a freaking dodgeball war in the waiting room.
Especially brothers.
However,
Absolutely.
my
Absolutely.
favorite is, now we're in Texas, the parent that has known us for a while, damn it, you're going to sit there, and if you don't shut up, you are not getting a bouncy ball. It's done. You're not getting one today. I'm not letting him give you the token. You're done.
We need more parents like that.
Yeah.
We get that. We get that quite a bit. We're like, oh shit, he can have the bouncy ball. It's cool. It's cool. We're good. We're
It's
good.
okay. It's okay.
You get scared too. You're like straightening up.
Do you know how many dents I have in my drop ceiling from bouncy balls? Like so
Yeah.
many.
Yeah.
Because
Well, I have a beautiful home, I'd like to think, and I have sticky marks on my ceiling from the stuff that the school gave them.
Oh, don't go there,
the little
Jeff.
sticky hands.
And they'd stick on the ceiling, and about 6 years later, it would fall down, and you've got this
Residue.
mark on your ceiling, or whatever Jeanette just called it.
Slime.
Yeah.
All right, one final question. If you had to give advice to GPs and pediatric dentists trying to work really well together, what are some of your takeaways over the last however many years you've been practicing? With the GPs that you work really well with, what are some key consistent themes? Communication, referral types?
Oh, sure.
You know,
Yeah,
all those
obviously
things that make a
communication.
successful relationship between
Yeah.
the two, because we all work together really well, I think.
Yeah. Collaboration,
Right.
right? Knowing your strengths and your limits, right? Knowing when to refer.
Yeah.
I say, when in doubt, refer it out. You know, always be aware of like different treatment options, but just because you don't necessarily perform that procedure doesn't mean you shouldn't mention it. And like find colleagues that do that procedure and do it well, and refer them. I always feel badly when I'll have someone, like, especially in the dental forums, will be like, oh, I'm going to do a pulp and crown tomorrow for the first time in my life. And I'm thinking like, maybe let's take a little refresher class on that first. Like, you don't want the kid to be the guinea pig. Like, that's a scenario where maybe we need to call up our buddy Jeanette and say, hey, can you handle this one?
Do you do a ton less of that now than when I was seeing a lot of kids early in my career, I did a ton of pulpotomy stainless steel crowns. I would imagine you got to be doing so many less now.
Yes, absolutely. And especially pulpotomies, because now we know indirect pulp cap is superior. They have more successful outcomes. I do a lot of class 2 resin modified glass ionomer fillings.
Yeah.
And they're fantastic. And the parents would much rather have a little white filling than, an 8-pack of silver caps. I mean, some kids you have to do the crown, and I certainly do crowns, but we also have other ways to accomplish that, like we do Hall technique, where no prep stainless steel crowns. So it's like I said, totally different than 2003 when I graduated dental school, or 2005 I should say, when I finished my residency. So
it has changed.
Who knew? Yep.
And we didn't even talk about grinding in kids, because I loved when you said maybe we should send you for a sleep study. And I had a professor in dental school, when kids would come in, it was evident that they were grinding. The kids are very obvious to pick them out. They just flatten them out really quickly. Or the parents are like, we were on a soccer tournament last weekend, and little Johnny was sitting in our room, and man, he was like a buzzsaw all night with those teeth back and forth. And the pediatric professor that I had in dental school said, you should just buy earplugs. They'll grow out of it.
Isn't it like sad when you think back of, like, we didn't know what we didn't know. And, that's why we take continuing education.
That's right.
No one knows it all, and we're constantly learning.
Absolutely.
Things are changing, my friends, but not the AAO. They are not changing.
No, they're not
but
changing.
The rest of us are.
Yeah,
Oh.
the 1925 literature still is the standard.
Entrenched.
Yeah,
Sorry, I had
digging
to.
their heels
It
in.
was too easy.
I
Yeah.
should send you a great article that I always quote when I'm talking about minimal interventions and that phenomenon who like people who are resistant. It's don't know, can't do, won't change, barriers for,
Yeah.
and moving knowledge into practice. But yeah, there's a phenomenon known as willful ignorance where people choose not to learn more about something because it perhaps challenges their current beliefs.
Well,
And that's unfortunate.
Yeah, I know. And and this isn't specific to the AAO, but in general, change sometimes it has to acknowledge the fact that maybe we didn't do it the best that we could have for however many years that we were doing it. And I can recognize how that is a very hard,
It's
emotional
humbling
and mental
Mm-hmm.
hurdle
Oh, absolutely.
to cross over. And
Amen.
for an organization in particular, you don't want to alienate your membership base. So you have that to manage as
I
well.
guarantee they have members that are also disagreeing with them.
They do, and
They do. Yeah,
they're going very
Yeah.
public. Actually.
stay tuned. We're gonna have
Yeah.
a few of them. We're gonna have a few of them on. So
Yeah,
yeah,
that-
stay tuned
You'll
for
be
that.
you'll be on the right side of history.
Yes, for sure.
I mean, I don't even care about that. I just I don't like dogma and any form of any medicine or science.
Yeah. Dentistry is like a religion.
I'll say the
It's
same
nuts.
about a lot of things that happened in COVID. It was just a dogmatic approach. Like
Mm-hmm.
I just like problem solving. I like science driven thought, and like science for science sake is not enough. We are problem solvers, and science is always based on challenging the norm or challenging what we know, or we wouldn't know half the things that we know now. If we just accepted that gravity didn't exist, then we wouldn't know that gravity was here. So I like exploration, and I think if we stop losing that hunt, that desire, we aren't advancing biology and humans, and that's supposed to be our goal.
Mm-hmm.
I'm sure I did a lot of things wrong for the first 20 years.
Oh, absolutely. I feel guilty about things that I've done.
Yeah, well, we're gonna find out.
I just didn't know any better.
Yeah.
Some product we used was terrible, and we don't know it. We're chunking it and churning it like it's because it's the best thing that we know, and then one of our kids will go to dental school and they'll go, "Ooh, you used."
Yeah. What in the medieval times were you doing, Mom?
Exactly. I'm just over here cutting kids with lightsabers. Don't mind me. It's fine.
Yeah. Well, they give us all that education so that we can use our minds in making a decision, not to just accept what we've been told in the past and not use that brain and accept old science that needs to continue to be built upon, because we will always continue to learn. Everything that we write at some point in the future will be wrong in some context or another, and we all have to be willing to accept that. So all we can do is the best with the information that we have now, and just use good clinical sound judgment and common sense, which I think we're seeing less and less of.
Sadly, yes.
Yeah. All right. We went way over, guys, but we love talking to you.
Sorry.
So glad you came on tonight.
Yeah.
Thanks for having me.
And during the middle of it, Brian Bell was making me laugh.
What did he say?
He was being a bad boy.
That's my husband.
You need to punish him.
He text me and say he liked my sweater.
That's Jennifer's husband was trying to make me laugh, and he got a chuckle out of me. So,
well, I just want to thank you for being here tonight. Yes. And as we close out, I am going to take one pearl from tonight. And you said something that I think is very critical. And I'm going to preface it by saying that we have specialists in dentistry for a reason. And so when you said, when in doubt, refer it out, I can't tell you how much that should resonate to all of us, because I can tell you that no amount of money is worth sometimes the heartache and the misjudgment on our behalf and unintentional mistreatment of children. send it out. If you don't feel comfortable with it, send it out. That's why we have pediatric dentists, why we have specialists in that arena, and in so many other arenas of dentistry. But just practice within your comfort zone and don't stray from that. Don't try and be the hero, because in the end, you won't be. But
Hey, Chad, I always tell the parents, I don't want to be the doctor that your kid is telling their kids about.
The therapist.
100%.
Yeah, I don't want to be that person.
I always say I don't want to be their trauma.
Yeah.
I want them to remember this as a fun place, as a loving place. And that doesn't mean that they're going to think of the pediatric dentist differently. It just means that they have that additional training to make that the fun and loving place as well. And I also say, you know what, if you decide to continue your treatment there, I am perfectly fine with that. But, I sometimes say, once they figure it out, if you guys want to come back here, I'm more than happy. But this is out of my realm of capability. So I just want to thank you for what you do, because there are so many specialties in dentistry that I think that I'd probably be good at. Pediatric dentistry is, as much as I love kids and much as I love being a father, I can't do it. So I commend you and thank you. And you all are in my back pocket daily. So just remember what you're capable of and what you're not. And remember, it's in the kids' best interest to send them off to somewhere that will be able to treat them more appropriately. So with that, I'll close, and good night, everybody.
Have a good night, all.
Thank you so much.
Yeah. Loved having you. It was great.
Bye.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.